Welcome, Alison Hardacre from HealthKit.
Thank you.
You've got a very successful business that's grown quite a lot. I guess we'll start with why did you get into this business to start with? What opportunity did you see?
We saw that the internet could really make a difference in health. It was a real opportunity to change the world. That's ultimately why we got into it. We saw that there are a lot of problems in health, both for patients and doctors. So doctors complete at least an hour of administration, patients can't find the right practitioner, and there's so many problems. By bringing patients and practitioners together in the one platform, we could actually solve a lot of issues. So we started off just in Australia, and then recently we've actually moved to global. So now we have practice management software for doctors all over the world, and then for patients, a directory to find the right practitioner for them. We also do online consultations, which is really important because I didn't know this, but in rural areas, people have a 4 years less life expectancy, partly because they have lack of access to health services. And so if we can start to make health efficient, effective and accessible everywhere in the world, we really are changing the world.
Alison, technology is changing so rapidly. You're at the leading edge of that change. What is it that you're doing that differentiate you from the traditional software solutions?
I think a lot of the legacy software is about computerizing the practice rather than removing administration. And if you can remove administration, then you're creating a better health system. So with our software, instead of the user having to create a booking, then create an invoice, then create a clinical report, it's all done for them. All they need to do is make a booking, and all their payments, invoices and reminders are automatically processed for them at the time of the appointment, as well as their financial reports and even clinical reports. Leaves them to focus on treating patients. And what we're finding is that practitioners are getting back an hour a day where they can treat patients. And that's fantastic because in this country, 2/3 of people don't get the help they need when they need it. And that's what we're about. Australia has a fantastic health system, but often it's held together by the willingness of people to go to the nth degree. If we can actually use software to remove some of that administration, we can help those people do even more.
So some of the trends you're seeing, sort of self-diagnosis, people laugh about Dr. Google.
Well done it.
And then also you've got the software as a service. So how are you positioning your business with those trends?
I think it's a fantastic opportunity these days because patients are so much more aware of their health than they were 20 years ago. And the internet provides a lot of information, but some of it may not be that good. And so one of the things that we do is a lot of research, and we're very focused on making sure our software is clinically based for patients to find the right practitioner. We're also developing clinical tools to track your health for every single condition and share that with practitioners. So that sharing with practitioners ensures that the results are clinically based, that it's not just something you've read on some website from somewhere, and that you're really getting a better health outcome as a patient. In terms of software as a service for practitioners, what it means is that they can access it no matter where they're located. So that's at home, that's across the clinics that they operate in, and it really means that we're able to update the software so much quicker. So practitioners aren't waiting for a year for some update that they asked for 2 years ago. It's really about so much faster for the patient and for the practitioner.
So you had this vision, you had this opportunity. How did you go about realising that and building the software to realise that dream?
Well, we started off just in Australia, focused on allied health medical specialists, and then we realised there was an opportunity to do it across the whole health system, including GPs, and to do it on a global basis. So last year we set about building software that could handle any health system in the world. It was character building because every health system is different.
Yes.
But the learnings that doctors can have from other doctors overseas makes it all worthwhile. And so right now we're growing all over the world and all over Australia. And it's really exciting because the software that we provide is actually free.
Alison, what really I'm impressed with your business and you as the leader is how you've got this vision on improving the healthcare system. You've given us tangible examples of where you've worked and designed your software to do that. So well done to you and the team at HealthKit.
Thank you very much.